with ADHD, how do you get somebody so young, first of all, to settle down, and then you're going to explain this to them and say, hey, actually, you can do this where you can quieten down aspects
Yeah.
of your mind and you can learn to focus. Because I know the kids tend to fidget and short attention span, etc. So you're saying that with this neurofeedback, you can get somebody to just settle, focus, be still, and become self-aware. And they can do it by telling their brain to do it?
Exactly. The ADHD side of things and learning disorders, this is our most studied. We have the deepest science in this. And in my clinic, we see these kids come in. They're like little fireballs. They don't sit still. They can't, especially boys. Boys are much, but the girls can do it as well. Um, uh, they can't focus, and you think it's an attitude. You think they're not trying, or you think that it's they're being willful, or that. But the real science comes when you ask the question, why do they have to do what they're doing? That's when you start asking proper questions. For example, with the ADHD thing, with the hyperactivity, that is a paradoxical solution to a problem. And the problem is the frontal lobes are not engaged. They are not optimized. They're under-regulated. So there's slow wave activity occurring when they need to be in the waves we're in now, which is attentive, and it's quite a higher burning of glucose level of brain activity. Okay, so the kids are adjusting to this problem by having some odd manifestation, like being the class clown, which was myself, I think, as a kid, and being hyperactive or whatever. And in the inattention side of things, the paradox exists there too, because it's rarely that the kids are not paying attention. The fact is they're flooded with their attention circuits are flooded. They are not gating. They are not selecting what to attend to. Everything's coming in. What's Johnny doing back there? What's Mary doing there? Anything but what's on the board. so, so that they have this inability to control and focus. Now, this can happen in business as well. When you're trying to work through your business plan, you can be paying attention to all kinds of peripheral things and just going off the focus. And it's so easy to do, fussing around with details, making sure your stapler works, rather than forming the type of relationships you need to exceed to your current position and move to a better place in business. So the same with the ADD kids, the same with affective disorders. These can all affect your performance in business. These things just don't go away. If you have these conditions, you tend to adapt to them. So and it's rarely recognized in adulthood, but we can see it in children much more clearly. But we are those children. So if we grow up with an ADD type brain, that's going to be in your business behavior.